Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Wednesday, June 17th. We are joined today by the Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. We also have with us Mary Thiessen, our American Sign Language translator, and André Boursier from the French Language Services Directorate, who will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Premier Silver?
Thank you very much, Pat. Hello, everybody, and thank you for joining me on the traditional territory of the Kwanlin Dun First Nation and the T'Anquatchin Council. This June has been quite different for Yukon. We're all missing some of the familiar sights and sounds that spring or early summer usually bring. June is Pride Month, and usually we would be gathering up for parades and celebrations around the territory. I know that these celebrations have been delayed, and my colleagues and I look forward to celebrating in whatever way we can at that point. Last week we graduated. We celebrated the milestone of Yukon students, Yukon Graduation Day. Congratulations to all of Yukon graduates. You've accomplished something extremely special, and I wish you all the best into the future. Now that the school year is officially over, I want to thank and commend the teachers, the parents, the students, the school staff, the volunteers, the coaches, the counselors, CELC officers. Thank you very much. Well done. It has not been an easy year, but you've all showed incredible resilience in the face of adversity. Congratulations on wrapping up a unique school year filled with extra learning opportunities. Since March, Yukoners have learned so much. Skills like managing a video conference call with 18 or so 6-year-olds, or making sure that the dog doesn't bark while you're doing a live radio interview. Almost all of us can navigate the different online grocery shopping options that, and again, these weren't the case just a few months ago. As always, I'm extremely impressed by the resiliency and community-minded spirit that Yukoners have shown. This will need to absolutely continue as we move forward. All of the hard work that Yukoners have done, to make sure that we have very minimal spread of COVID-19 in the territory, it means that we are on track. We are on track to move to Phase 2. This plan is to begin the Phase 2 in July 1st. Barring any major changes to epidemiology of the virus in BC or in Yukon, we will be opening the borders to British Columbia residents. The details of what will be required of BC residents are being determined and will be released as soon as possible. Phase 2 will also see the lifting of other restrictions. Restaurants will once again be permitted to operate at full capacity. Outdoor social gatherings of up to 50 people will be allowed. Dentists will be allowed to resume non-urgent and routine care. As we all continue to move along the path forward, I want to remind Yukoners that we all have a vital role to play as we look to lift restrictions. On Friday, bars will be approved. Bars with approved operational plans will be allowed to open again. I know that Yukoners are eager to return to a familiar place to socialize and catch up with friends. It can be easy to forget that we are all still in the midst of a pandemic. As you return to public places and socialize with others, please remember that you must continue to follow the 6 steps for staying safe. This includes maintaining physical distance of 2 meters, or 1 caribou, from those outside of your household bubble, washing your hands frequently, and staying home if you are feeling sick. Now more than ever, it's extremely important that we maintain that vigilance. We are fortunate here in Yukon that we have had very few cases of COVID-19, but it is only because we acted early and introduced preventative measures. Following public health recommendations is essential if we want to stay in the good position that we've earned when it comes to COVID-19. For all of the businesses that have reopened and are planning to reopen, be sure to check yukon.ca for resources that can help you to remind customers of their responsibilities. Signs are available to remind people to maintain physical distancing, wash their hands often, and not gather in large groups. These resources have been created by our dedicated public service, the same folks who are helping draft guidelines for individuals and organizations to help them carry out their work and activities in a safe and responsible manner. These are also folks like Mary here and Pat on the mic and Cam on the mic who have been in this press room for these press conferences, helping to keep Yukoners informed and up to date on the situation as it continues to unfold. There are also folks like the administration, folks that are doing the administrating of support programs that our government has introduced to help Yukoners, to help Yukon families and Yukon businesses to adapt to the realities of COVID-19. Support programs like the Yukon Essential Workers Income Support Program. The team at Economic Development is fielding inquiries from businesses on how this wage subsidy program can help support Yukoners during this time. As of Monday, 17 applications have been received for this program. Our business relief program, which has supported 139 business applications so far. So here's the example of all the public servants that are continuing to do this great work as we move and circumnavigate through these times. Which is a great segue to the fact that this is National Public Service Week. So I want to recognize the hard work of all public servants who have adjusted to the challenges of this pandemic and continue to provide programs and services that Yukoners rely on. Thank you very much. And lastly, I want to touch on an important day that is coming up this weekend. July 21st is National Indigenous Peoples Day. This is an opportunity to celebrate the rich histories and cultures and traditional knowledge of Yukon First Nations and Indigenous groups across Canada. My colleagues and I are proud that the first piece of legislation our government introduced established National Aboriginal Day as a statutory holiday in the Yukon. Yukon has a very strong First Nations community, and our government is proud to celebrate Yukon First Nations and Indigenous groups from coast to coast to coast. I encourage all Yukoners to continue learning more about Indigenous art and culture and achievements, and to celebrate this important day with friends and family. And to remember to practice a safe 6 as you celebrate. Thank you. Masi Cho, Ganesh Jish, Shonithan.
Thank you, Premier. Good afternoon, bon après-midi. As the Premier notes, we're still on track for the start of the next phase on July 1st. On the day the reopening plan was released, and again when Premier Silver and I talked about the possibility of moving to phase 2, I talked about what safety measures would need to be in place for me to be comfortable enough with the Yukon's state of preparedness to advise that we could go ahead. The things I talked about are basic but essential: a process of engagement with communities, the application of public preventative measures, confidence in the capacity of our public health system to respond, a low importation risk, good healthcare capacity, and an ability to measure COVID spread as well as keep track of unintended consequences. I'm going to walk you through some of these steps briefly. Our community engagement is ongoing with any number of individuals and organizations. Personally, I have regular calls with First Nation chiefs and a separate one with First Nation and community leaders. I have frequent calls with the doctors and medical leaders. Between myself, the Health Emergency Operations Centre and relevant government departments, we meet via phone with First Nation governments, municipal leaders, community interagency groups. We have met with the Business Advisory Council, government MLAs, sport and recreation governing bodies, faith leaders, camp operators, of course physicians and nurses and others. We will continue to meet to keep our partners in this battle informed. Advice and feedback that I have received from all of these groups, in addition to public input, has been highly influential in our planning. As far as public measures, the Safe 6, as the Premier noted, continue to be our best tools. When we talk about flu prevention, I often find myself saying that no matter how imperfect, vaccine is the best prevention. However, we also always stress hand washing and staying at home when sick as vitally important measures as well. With COVID-19, we don't yet have that vaccine, but the world has shown how effective these other measures are. Strong and consistent implementation of hand washing, safe spacing, staying home and away from others when ill will keep us out of trouble should COVID be present among us. Until we have our vaccine, our Safe 6 is hands down the best weapon we have. The problem arises when the rules are not observed. We know that individuals will not always follow the Safe 6, and we can all point fingers at each other. But more importantly, we need to support each other so that most of us are doing it most of the time. But we are also hearing about businesses and workplaces that have not taken the guidelines seriously enough. Now, to be clear, many businesses have been outstanding in how they're paying attention to observing safe spacing and sanitation. But then there are those who are less compliant. We all need to step up and remind each other of these important measures to keep us COVID safe. As of June 15th, 53 personal service establishment plans have been approved, and these businesses continue to open. 57 restaurant plans have been submitted at the same date, and again, they continue to open. We have seen bar operational plans arriving. All these aspects of life that we have missed are resuming, but in a modified way that demonstrates how carefully we have to do this. The majority of Yukon citizens who responded to a Canada-wide survey taken between April 3rd and 25th reported they avoided leaving the house for non-essential reasons, avoided large crowds and gatherings, and were hand washing and social distancing appropriately. I'm confident in our continued capacity to test and contact trace as necessary. The importance of contact tracing is our ability to successfully identify all of an individual's contacts and to quarantine and monitor them. Our success in doing this for our 11 patients to date, as well as our contingencies for ramping up capacity as necessary, gives me the assurance I need. An advantage of our process in Yukon through Yukon Communicable Disease Control and community nursing is that we have strong connections to the community, so we can find people. The follow-up to date has been 100%, and I'm confident it will continue next time we get a case or an outbreak, because we will get a case. As far as testing capacity, we know there were struggles in the initial stages to get our lab results back from BC CDC labs in Vancouver as testing ramped up around the country. Now tests are typically back within 48 hours. We have had no recent complaints, and I continue to be thankful for our working relationship with our colleagues in BC on so many levels. I've talked before about the risk of importation into Yukon, and I've made it no secret that COVID cases will come in from outside the territory. But we are seeing, of course, continued decreasing trends in COVID-19 cases across the country. This is another positive trend that allows me to advise for transition to the next phase. Regions are reporting fewer cases, and the majority of these cases have a known source of infection. Cases in BC continue to drop overall. Northwest Territories, of course, has seen no cases in 10 weeks. Alberta is seeing their numbers drop as well. As we contemplate how we live with COVID-19, we need to strike that balance of an acceptable importation risk. With all the right measures in place, we need to adjust our measures and our risk tolerance to allow for the possibility of cases that we can still manage to contain. We will continue to follow carefully the evolving epidemiology in the rest of the country and internationally. We continue to monitor our borders, and yes, people are coming through. As of June 15th, 4,325 people had come through the border since it was closed, and 150 were turned away. Even as we look towards reducing restrictions on border entry and self-isolation, we have to contemplate scenarios where these might have to tighten up again. This will not happen with occasional cases or even outbreaks, as that is part of living with this new reality. but we would consider restrictive measures again should there be COVID spread that would stretch our capacity to contain. As long as we are careful, methodical, and are prepared to keep people and information at border crossings, I'm not particularly worried about BC residents coming into Yukon. We should welcome them, as I hope people in BC would welcome Yukon residents. As I discussed last week, based on the epidemiology of actual active cases in BC, the risk of introduction of cases in Yukon is very, very low. And with additional public health measures in place, the impact from any one introduced case would also be low. Let's explore that in a little more detail. To reiterate the numbers I used last week, of the 5 million people in BC, around 200 or 300 have COVID-19, accounting for people who may be positive and not tested. Even with 10 times 200, we are still talking about a 1 in 2 to 3,000 risk that someone coming from BC will be carrying COVID into Yukon. Add into that all the safety factors of reducing exposure to others, and we end up with a very small chance that that person will share the virus with others here. Not a zero risk. We cannot get there, but a risk that we should be ready to accept. The acceptability of risk depends, of course, on one's own attitudes and proclivity to taking risks, and importantly, as to whether one has a choice in the matter. Unlike skydiving or hang gliding, in which the risk is limited to the person making the leap, most of the time, with COVID-19, the actions of an individual change the risk levels of everyone in the community. So I can understand how people are nervous, especially if they, for a variety of reasons, may be more susceptible to COVID infection or complications. Their health relies on all of us to follow the precautions and the safe six. And it's hard to trust others to make smart decisions or to do the right thing. But remember, we all do have a choice in this matter, a choice to do our part to mitigate and manage risks by following the rules and the advice. It's not easy to find this right balance. We are going in this direction for a reason, though. COVID protection can be overzealous if we are not balancing COVID risks with the health and social risks of over-restriction. I'm often asked what I worry about, what keeps me up at night. As a physician responsible for the public health of all Yukoners, there may be a lot of things that keep me up. Graduations were very different for this class of 2020, but apparently that didn't entirely stop the traditional bush party from happening. And if you have 300 young people gathering and add in alcohol and the relaxation that comes with it, then we could have more than the spread of COVID to worry about. That kind of thing keeps me up at night. Farewell potluck lunches as well for large groups of people. Close, prolonged contact between individuals not in the same bubble. Indoor buffets or any sharing of food from single dishes by multiple people. That's the type of risk that might interfere with my sleep. We're all responsible for public health. I may be the chief of public health, but all of us are public health deputies. And it's up to all of us to follow the rules and advice, to wash hands, to keep our distance from anyone not in our bubble, to clean shared surfaces, not to gather in groups unless less than the maximum numbers in the guidance for whatever that setting is. The steps we take as individuals will not only keep ourselves safe, but will help keep our neighbors safe, and the workers in the grocery store, and the stranger we nod to at the gas station. We have a responsibility in this. We have a responsibility to be responsible. That's all for my update. Thank you. Merci, merci, Jo.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll now go to the phone lines, and we'll begin with John Kennedy from CKRW.
Hi, my question is for the Premier. But if, Dr. Hanley, you feel this applies to you as well, feel free. Businesses that have been submitting their operating plans to reopen have reported being bounced from department to department when trying to get some clarity about guidelines or seek information. And I'm just curious as to what the turnaround time is for when an operational plan is submitted to when it's approved.
Thanks for that. I know that Dr. Hanley has mentioned timelines before being 48 hours when we first started down the road of the guidelines being presented on the website and the operational plans. I don't have a current up-to-date number as far as the amount of time it takes businesses today, but as we move from phase to phase and as we meet on a regular basis, there's always going to be some growing pains in the system, and we make sure that we take these things in stride. We take the information that we get from the businesses, from the folks that are trying to circumnavigate the system, and we try our best to apply their concerns into the system. And for the most part, it's working very well. We've seen a very quick turnaround with the restaurants to get them into the operational plan. As we now move towards bars, there's only a handful of actual businesses that are just bar alone. We'll continue to monitor the situation and make sure that the turnaround time is not all that onersome to the businesses.
Dr. Hanley?
A couple of things. One is it's important to distinguish between those workplaces that are under regulation and that actually need approval before going ahead. And those are the ones, as we've talked about before, the personal care establishments, drinking and eating places, restaurants and bars. Basically, the other workplaces that are not under regulation and under the Public Health and Safety Act or regulated by either by the Liquor Board or by Environmental Health, do not need approval of their plan before. It's just that they need to have a plan ready for potential inspection by Workers' Compensation Health and Safety Board. So that there is a distinction. And then there's the event process. And we have been trying to put in, events are not necessarily needing approval. They just have to comply with advice or orders, in as much as the advice might apply to how people need to self-space within a facility, for example, but at the same time as observing orders such as mass gathering orders. So again, there are a whole variety of questions, some or submissions, some that are just coming for comment, and some that are coming from for actual approval. And if there are individual circumstances where there have been delays, then let us know. We'll try to address those. As the Premier said, we're continuing to try to improve processes. There's a lot on the fly at the moment.
Do you have a follow-up question, John?
I do have a second question. It's not exactly a follow-up.
Go ahead, please.
I guess once July 1st rolls around and we enter phase 2 of reopening, Premier Silver, will you consider reopening the Legislative Assembly or recalling it, seeing as the epidemiology for the territory is suitable?
So the Legislative Assembly, of course, opens for the passing of bills. We've passed our budget in March with the unanimous consent of all parties in the legislature. And so no need for any more budgetary conversations for the 2020-21 budget. When it comes to emergency spending, we'll do what every government has done. We'll use the supplementary budget in the fall to make sure that the scrutiny is there for every dollar spent during these emergency times. And in the interim, we will continue to do what governments do in the summer to make sure that we're available for the public service, and also monitoring the situation of COVID and the restrictions of the Civil Emergency Measures Act.
Thank you. We'll move now to Gord, Yukon News.
Yes, I was wondering if you could go through the decision-making process on why the territory will be opening up first to British Columbia.
Thank you. Good question again. We're blessed to have a region that is that we share a lot of medical expertise and assets together. Before COVID, with British Columbia, we've got a great relationship with them, based upon geography just in the past, but mostly in these COVID times, we're even more blessed that the social media campaign from the government and the measures that they put in British Columbia have worked to not only reduce the curve, but to plank the curve in British Columbia. So our consideration is based upon the epidemiology of our jurisdiction and the epidemiology of their jurisdiction as well.
Dr. Hanley?
Thanks to that. I'll just add a couple of things to that. I agree with what the Premier said. We know that that border closures are not sustainable in the long run. We know that even mandatory self-isolation has to be revisited continually, and that we have to again continue to find that right balance between allowing movement of goods, movement of people, allowing families to get together, allowing visitors, allowing some economic activity. All of that is part of the balance of a healthy, thriving society. So it's continually to relook at how we can adjust that balance as we get more confident about COVID risk, and that of course can go in two directions. But as the Premier said, BC is in a very good place. Plus, we have such a close working relationship with BC that if we are going to move in that direction, it really made sense to us to begin with our neighbours, with whom we have an extremely close working relationship, and where with a jurisdiction that has demonstrated successful flattening of the curve due to a very strong and coordinated public health response.
Premier Silver?
Yeah, and I'll just add into that. I'm glad that Dr. Hanley reiterated the statistical analysis of risk when it comes to opening of British Columbia. Let's remember that the borders aren't 100% closed right now. We have the transportation of goods coming up all the time. We have fuel trucks, we have grocery trucks, we have critical and essential services. So there's always been traffic from us and the rest of Canada. I am more concerned, and of course Dr. Hanley will weigh in on this too, I'm more concerned about folks gathering the way that they're not supposed to gather right now, like mentioning of the bush parties, gathering in your backyard for barbecues that's not in a bubble, which is more people together and not doing the social distancing. I'm a lot more concerned about that being problematic than the addition of British Columbia into our bubble. Again, we have to stress that Yukoners need to stay vigilant in practicing the 6 steps to safety, and also be careful that they choose to about their traveling. Again, we're still asking people to not travel if it's not necessary. This measure of opening up, based upon epidemiology with British Columbia, we've done the analysis, and again, we're more concerned with Yukoners maintaining that safe 6 right now. So please, anybody listening to this, again, we're not out of the woods, and what got us here is your vigilance, and we're asking you to continue that as we move forward into our next phase and try to get back to some form of normalcy.
Thank you. Follow-up question, Gord?
Understanding it's not easy predicting or possible to predict the future, would you be able to give an idea when how reopening would look for further provinces, towards which phases that would be?
You're right that it's extremely hard to predict. So we're not going to. We'll let the science, the epidemiology in those regions determine that. Again, I've heard Dr. Hanley express, an objective opinion about how we're going to look at other regions, and again, it's based upon how well they do to planking their curve. Dr. Hanley, anything to add to that?
No, I think that's true. It is obviously what we are thinking about and analyzing at this time, so we can provide the appropriate advice. But it's also a matter of incremental steps. So we really want to try to get this right with BC and to do it well, and that includes having appropriate information at the border. So again, this is not just let everyone in from BC approach. It's really an incremental step away from enforcing self-isolation on BC residents based on a number of criteria, which will include still a conversation at the border, a declaration, and advice on what to do if symptoms develop, advice for our healthcare workers on keeping out of higher risk settings, and a very kind of measured, prudent, and controlled approach that will then allow us, I think, the ability to look at how we do the further steps. So very much a present conversation, and we will look forward to bringing you back further information as that analysis and thinking evolves.
Thank you. We'll move now to Jane, CBC.
Hi, this is a question for Dr. Hanley. You mentioned community engagement and which communities you've been engaged with, but what have you been hearing from communities about reopening the border and heading into phase 2 of the reopening plan? What feedback have you been hearing from communities?
Yeah, so I hear a whole, I think, what I would say, really an evolving conversation, and I think that's the fruit of a collaborative relationship. So we know that there was tremendous anxiety earlier on about vulnerability of the communities to COVID for a number of really good reasons, including, more limited healthcare facilities, uncertainties about medical transportation, and the sheer isolation of communities. But I think as we've, worked on the evidence together, gone through these phases of shutting down and then gradual opening up, we've seen a real kind of a collaborative response, and community protection remains, not just community engagement, but protection of communities remains a cornerstone of our COVID strategies. So part of that is mechanisms for supporting community nursing. Should there be a case in a community, walking that through with the community, how does that look, and how would the public health response ramp up as necessary in particular communities, working with, of course, our healthcare partners in EMS and the medical community, as well as community nursing, on how that response actually works. But also talking through risk analysis and talking about what the communities want to see, that very much a bilateral or multilateral conversation about visitors. When we talked about opening up campgrounds, how should visitation look? Where are communities in that readiness to take on more visitors, more economic activity, more chance to participate in the reopening? So I see this again with some variation between communities and variation between First Nations as a positive ongoing conversation. I don't know if the Premier has much to add there.
Yeah, I mean, I agree with all that. I just would add, the Association of Yukon Communities, the conversations with our governments and them is extremely valuable. The relationships that we've fostered as well through the Yukon Forum and the working groups, and it's so important to have that connection so that when we do move to different steps or contemplate different steps, what we get back from the communities is solutions, supports, identifying where we need to do more work or areas that have been covered well. And again, we are extremely grateful for the communication that we do have pre-COVID. But again, any of those conduits of communication that we had before this pandemic, they have been fortified. They have been strengthened, and again, this is going to be part of the new normal of moving forward. Is even better relationships with these governments as we travel along this pathway of recovery.
Thank you. Follow-up question, Jane?
Yes, my follow-up is also for Dr. Hanley. You mentioned that going back to more restrictive measures wouldn't happen with just a few cases. It would be a strain on the healthcare resources. So what's the criteria you're judging a small outbreak on versus a strain on healthcare resources when we've seen that it seems like COVID-19 can spread quite quickly or quite easily? How do you judge that?
Yeah, it's a very good question, and I think there are many factors that could go into that. One is competing outbreaks. The other would be competing diseases. So what happens if we had a bad flu season and then we had multiple COVID cases or outbreaks at the same time? That could be where we could start to see strains, more likely in public health capacity than healthcare itself capacity. capacity. But the sheer ability to just do the catch up that might be required in catching up to, say, multiple outbreaks. I think this is unlikely. Again, we're trying to go incrementally enough so that this doesn't happen. But as you say, sometimes things can happen very quickly. You can get very large outbreaks associated with introduction of a case into a susceptible setting. So we continue to do the work on making sure that we identify and protect any susceptible settings, and do that work to keep us from getting into trouble from COVID, so that we are able to contain the smaller outbreaks that may happen, like household clusters is the most common type of outbreak. Let's say a couple of communities that have cases at the same time. Those are things that I'm confident that we have the capacity to handle. So it really becomes maybe a combination of circumstances, or just a scale. Maybe COVID changes. Maybe something about the virus changes, and it becomes much more transmissible or virulent in some ways. So there's always those unpredictabilities as we see more. As we get, more deeply into this pandemic.
Thank you. We'll move now to Chris, CBC.
Hi, thanks. It's a question for the Premier. As you are no doubt aware, tourism obviously has taken a major hit as a result of COVID-19. The Statistics Bureau is on the record saying that unemployment has effectively more than doubled as a result of COVID-19. I guess I'm wondering, what analysis has the government done on the impact that this economic slowdown is going to have on both the territory's GDP and on the territorial government's budget outlook?
Yeah, good question, Chris. I know that there's an awful lot of work that the Department of Tourism and Culture has been doing to engage with not only the Business Advisory Committee, but also the stakeholders in the tourism industry. And they're going to be moving forward on support methods there. We have some relief programs for businesses in general, but we really want to focus in as well on how we can support our tourism industry. This conversation is, so tourism is dealing with the issues on a local basis. On a national basis, we're adding to the federal conversation through the Council of the Federation, talking about next levels or next steps of relief in tourism. It's been a conversation that Yukon has been pushing, Newfoundland and Labrador has been pushing as well, and to see if the federal government, we know that there's been an announcement for the federal government from some supports into the tourism industry there. A lot of that is based upon the regional specific concerns and questions that have been raised through the Council of Federation, being fed in from those really important stakeholder conversations that Minister Dendies and her team have been providing locally.
Next question, Chris.
Yes. Well, with respect, Premier, you didn't really answer my question. What work is being done, and I guess what is the initial outlook in terms of what the economic damage is to the Yukon, and what is it going to do to the territorial government's bottom line?
Again, everybody recognizes that this will have an effect on the bottom line. Tourism has got out of the gate very soon after our cancellation of the Arctic Winter Games, for example, for an action item that you're looking for to make sure that cancellation was figured out for these major events, but also feeding in that information to the Business Advisory Council and hearing from that. Of course, a lot of our businesses, our tourism-based businesses, will continue to monitor the situation, and it will have an effect absolutely on our GDP. Where I went in your question is, on a federal basis, what I bring to the table of the Council of the Federation is to support our tourism industry. The work that Jeannie Dendies and her team as the Minister of Tourism and Culture, working with with the stakeholders and the businesses here locally, all of these actions are going to help us determine how we're going to deal with an obvious decline in the GDP. I don't think we need to do much of a statistical analysis to see that there's going to be a concern here. There will be. And again, what we're focusing in on right now, Chris, is, we do have these different tranches of money that have been set aside for either fixed business costs, sick leave provisions, those types of things. But what specifically to tourism did we not catch either through federal programming or through local programming and services? That's our concern now. And more to come on that. I know you'd like to get a little bit more out of me now, but until the department is ready for those announcements, I'll leave it to the department to talk about next steps.
Thank you, Premier Silver. We'll move now to Gabrielle, Whitehorse Star.
Hi, just looking for a clarification. You mentioned in phase 2 there will be restaurants at full capacity or outdoor gatherings of 50 people, dentists reopening, and etc. Will all these things happen at once on July 1st, or will they be rolled out slowly as has happened in phase 1?
Yeah. So again, we saw similar things in the first phase. We have a lot of work to go before we can make an announcement as to what exactly happens, other than the BC border being open as of July 1st. We will continue to work with EHOC, with HAWK, and the other agencies to make sure that we have a staggered approach, and we'll do our best to make sure that we have enough information for those that it will affect in a timely fashion. But more details to come on what exactly will happen directly on July 1st, and then what will happen in subsequent weeks.
Yeah, I agree. Yeah.
Okay. Follow-up, Gabrielle?
Sure. For the question for the Premier, I'm hoping you can please comment on the petition that was filed yesterday with the Yukon Supreme Court. It applies for an order that the Civil Emergency Measures Act violates the Charter, and its extension should be subject to judicial review.
Yeah. So again, you know how this works. Now that it's before the courts, I won't be commenting on the case specifically. We are reviewing the petition that has been filed, and we will address it before the Supreme Court of Yukon. Obviously, we're confident that the decisions we made are required to protect the health and safety of Yukoners and place reasonable restrictions on the liberties of Yukoners and Canadians. And again, my ultimate goal, of course, with Dr. Hanley as well, is the safety and the health of Yukoners, and that is paramount to this administration.
Thank you. We'll move now to Julien, Aurore Boréal.
Oui, merci, je n'ai pas de questions.
Merci. Claudiane, Radio-Canada.
Oui, première question pour le docteur Hanley. Peut-être, si possible, me donner les détails ou le plus que vous avez des lignes directrices, des guidelines pour les dentistes. Comment ça va se passer?
So the question is for Dr. Hanley. Can you please give us an idea of what are and the guidelines for the dentist opening for general operations now?
Oui, les conseils pour les dentistes, c'est qu'ils seront permis d'ouvrir leur clinique aux pratiques générales, pratiques normales pour les procédures normales le 1er juillet. Donc, les conversations ont pris place entre l'association dentale du Yukon et les services communautaires pour la régulation des services dentaux. Mais comment ça va aller en pratique à partir du 1er juillet, ça va dépendre de la clinique. Mais c'est une question de donner avis pour comment faire le contrôle d'infection dans la clinique selon les besoins de protection contre COVID. Et puis, quelles sont les distinctions entre les services urgents et routines. Et donc, tout ça, c'est une partie des délibérations entre nous et les dentistes. Les guides sont plus ou moins basés sur les guides de l'Alberta, la province de l'Alberta, comme base. Et donc, c'est comme ça. C'est maintenant avec la chance pour maintenant, c'est pour les dentistes avaient l'expérience maintenant de traiter les patients qui ont besoin des procédures essentielles, la procédure urgente. Et donc, on est bien placé maintenant si on continue de mettre en place tous les besoins pour protéger contre les risques de transmission de COVID, de faire les procédures, les visites routines, c'est très important. Donc, parce que évidemment, il y a beaucoup de personnes qui ont attendu 3 mois pour avoir les visites d'un temps.
Could you please repeat in English, Dr. Hanley?
Sure. I was just talking about the guidelines the question was about the guidelines for dentists and a little more detail into what are the guidelines. And really, we've been working for a long time with the Dental Association as well as the regulator, which is Community Services of Government of Yukon. To establish guidance, and part of that is the difference between emergency and urgent care as well as routine care, and then what are the infection control measures that need to be in place, including risk assessment for people to come into the clinic. So what are the expectations in terms of infection control? This is an area which I didn't say in French, but this is an area that dentists are already very well practiced in. So it's really just bringing everyone up to the same code of expectation as far as prevention of possible transmission of COVID within dental environments. Now that they have been practicing not only emergency care but urgent care, and based on our current conditions, we feel in a good position now to open dentistry to routine care as of July 1st. And I also mentioned that our guidelines are guidelines for care as to how dental care should be carried out are largely based on the Alberta guidance.
Thank you. Prochaine question, Claudiane?
Oui, donc en français toujours, Dr. Hanley, vous avez beaucoup parlé de l'équilibre entre les mesures sanitaires nécessaires, les restrictions et les libertés des gens. Avec le recul, looking back, est-ce que vous pensez est-ce que vous feriez les choses différemment? Quelles sont les conclusions que vous tirez dans la difficulté de trouver cet équilibre-là? Does it make sense?
So the question is for Dr. Hanley. You talked a lot about the balance between measures to protect the health of people and opening the border and having a regular life. Could you... sorry, I lost it.
Claudiane?
It was really, when looking back retrospectively, would I have made the same decision? I think it was more or less the question. Et donc peut-être je vais expliquer dans les deux langues aussi. Pour moi, oui. Toujours on peut questionner si ça arrive encore, est-ce qu'on va faire les mêmes mesures. C'est important de considérer que le niveau de connaissance de ce virus il y a 3 mois c'est très différent de le niveau de connaissance maintenant. Donc je pense que c'était la bonne décision pour le moment et pour la menace qui en a perçu, et donc de faire des décisions très grandes dans un court moment de temps pour mettre en place les protections nécessaires. pour nous donner le temps de faire des préparations nécessaires pour faire toutes les protections qu'on a mis en place pour les mesures publiques, pour les mesures de protection des facilités de santé, pour les soins long terme, tout ça. Et au même temps, on a beaucoup de chances de connaître ce virus en plus de détails, où ça pose plus d'une menace, où ça pose moins d'une menace. Et donc maintenant, on a plus de connaissances, plus de préparation et moins de COVID, moins d'épidémies dans le reste du Canada. Donc, je pense que c'est les bonnes directions, mais c'est toujours avec un cadre où c'est fondamental pour la santé publique, c'est d'avoir les impositions le moins dures possible pour avancer au but qu'on a en vue. Donc, j'espère que ça fait de bon sens. I'll just explain in English. A fundamental, I'll begin with what I ended with Claudienne, and that is, it's a fundamental public health principle that you should always use the least restrictive means to get to where you need to go. And in the beginning, we had a blunt instrument that we needed to act on quickly. We needed to make some big decisions in a short amount of time for a very important purpose, and that was to protect ourselves, to protect Yukon, to protect a fragile healthcare system, to protect our communities, and to protect against something that was still new and not very well known. We've come a long way in 3 months. We've been able to put many protections in place, and as well as guidelines, as well as the ability to think out and to reiterate the public health measures that we need to protect ourselves, to protect our long-term care residents, and obviously a lot, so that we and at the same time, having known a lot more about how the virus is transmitted and where the risks are greater and where the risks are less, that allows us to be able to contemplate that rebalance so that we can still have the least restrictive measures possible for the aim that we want to achieve. And that's a continual process, and that should be a continual process. And as I said, it can go both ways. We have a lot of COVID to live with yet. We have a lot of potential phases to go through. But my hope is that we get to know this better and better, and we continue to maintain a balanced approach until we get to that golden time of having vaccine available.
Thank you, Premier Silver. Thank you, Dr. Hanley. Thank you, everyone, for your time today. A reminder that our next COVID-19 update will be Wednesday, June 24th at 2 p.m.